for calling Family Health Plan. To continue in English, press 1. If you are a provider or provider office, press 8. If you are a member, press 1. If this is a medical emergency, hang up and dial 911.
I hadn't anticipated needing Medi-Cal at this point in my life. And then life happened. I left my job with a plan to relocate closer to family, and days later I got violently sick. First a virus, then antibiotics, then C. diff, a dangerous, highly infectious intestinal disease. I also had surgery for suspected endometriosis on the last day of my employer coverage. If it had been one day later, who knows when or if I would have had that surgery. It took me 9 years to receive the diagnosis in my early 30s. And while I'm grateful for Medi-Cal coverage following my surgery, the system is a maze on its best day. Long wait lists, inter-county transfers, denied referrals, prior authorizations, and countless hours completing forms and calls. And even once you finally get seen, women's health is still misunderstood, underfunded, and deprioritized, regardless of coverage. But my story isn't rare. Around the world and across California, women with endometriosis spend years searching for answers. And for those in public insurance systems like Medi-Cal, an already exhausting search can become all the more so.
Immigrants and low-income women tend to suffer more and put up with more, so they may not seek care for their symptoms, thinking is normal or thinking they'll be dismissed. I think a lot of women don't necessarily understand what's normal. Blood clots are not normal. You should not be using like 6 to 8 pads per day, soaking them. But a lot of women don't know these.
I wish women knew that their pain is real, it's not in their head, and it's treatable. There are gynecologic surgeons who understand the complexity of endometriosis, that it's a whole body disease, that it's a progressive disease, and the impact that it can have on a woman's quality of life and fertility if that's something she's seeking. And it's not just about taking birth control pills. It's not just about taking pain medications. Surgery done by a fellowship-trained endometriosis surgeon can lead to better outcomes than seeing a general OBGYN.
So I think endometriosis is difficult to diagnose because you really technically need a surgical diagnosis. So to do a laparoscopy where you do a surgery, look inside the abdomen with a camera and either see the lesions or we take biopsies that confirm, oh, endometrial cells growing outside of the uterus.
For women who have Medi-Cal or are underinsured, access is the biggest issue. Often they're waiting months for appointments only to be offered the same treatments that are limited, like hormones, pain medication, and endometriosis surgeries that don't fully treat the disease. And very few fellowship-trained endometriosis surgeons are accessible through the public insurance network. So that delay in access can often complicate treatment in the future as well.
There can be gaps in care for like more complex patients, as often these endometriosis patients are.
Comprehensive endometriosis care requires a multidisciplinary approach, but many patients still receive fragmented, single-provider care. Pelvic floor physical therapy, especially when paired with targeted breathwork, can help reduce pain, regulate the autonomic nervous system, and decrease sensory hypersensitivity.
What we see usually with people with endometriosis is tightness in the pelvic floor and tenderness in the pelvic floor muscles, but also there can be even referral pain in the leg, in the arm. When there's discomfort in the abdomen, especially when somebody has endobelly, it's kind of like having a really bad stomach ache. And what do you do when you have a really bad stomach ache? Usually you're gonna hunch forward, you're gonna curl up. This makes it harder for the diaphragm and the pelvic floor to move properly. So when you're breathing, when you inhale, the diaphragm drops down and the pelvic floor drop down. You inhale and your abdominal contents go down, you exhale, the abdominal contents and the pelvic floor and diaphragm come up. So deep breathing can actually help to massage your organs.
My own mom has spent decades navigating this system as a patient, a survivor, and a caregiver. And she's felt and witnessed the disbelief and dismissal so many women face. She's watched society leap forward while women's health crawls behind.
We're lucky right now that women's issues are becoming important. Medical training and research was all focused on men, so there was no knowledge about women's issues. Medicine was heavily influenced by Freud and his diagnosis of hysteria. Women were locked away as their treatment. It's disheartening to see people not get what they need or even know how to go about getting it.
She's right. It's almost 2026, and the system still treats women's pain like a mystery, even with the top care plan. It took 60 days just to change counties, another 30 to get a new PCP, and more than 50 to maintain continuity with my out-of-network endo specialist. Nearly a year later, I'm officially scheduled for an initial consult with an in-network endo specialist. And in one of the wealthiest counties in the country, Santa Clara County hospitals and essential clinics and services are now threatened by projected federal deficits. My primary care clinic is closing December 31st, forcing a transition to yet another new PCP, my 5th in less than a year. If this is what it looks like here, what does it look like everywhere else?
We need policies that ensure that all women have access to care, regardless of their insurance. We need more state-funded and federal-funded fellowship programs that focus solely on endometriosis and complex gynecologic surgery, similar to fellowships that we have for GYN cancers. In some ways, some of these endometriosis cases, they can be as complex as cancer surgery. We need to stop minimizing women's pain, stop normalizing women's pain and suffering, and we need to listen. It's quite simple. We just need to listen and believe women. And I can't tell you the number of times I've done surgeries on women who have said, I had a prior laparoscopy, I've been told I don't have endometriosis, and then I find it. And it's not that it just popped up.
Women don't need pity. We need progress. Healthcare shouldn't be treated as a privilege for the wealthy and the few. It should be regarded as an equal right for all. We all deserve to be believed, supported, and treated with dignity. Because we deserve better.
We deserve better.